can these be painful? What's the home remedies y'all have heard? Aloe vera does work. You know what the best aloe is? That plant that's on Mama's porch. Guys, I'm dead serious. And if you take that plant, now don't freeze it. Do you put ice on a burn?
No.
Absolutely. What happens when you make something get cold? Vasoconstriction. If you have a bad burn, it will make it hurt worse. Room temperature water. If they on fire, put them out. How many of my patients? No, you're not. Put them out. Stop, drop, and roll. Never put ice on any burn. Yes, sir.
I don't know if you know about this, but when I was little, I touched an iron, like with my hand, and my family put like this, the middle, like in between the eggshell and the actual yolk, they put that little thin layer on my hand, and it healed it up really good. I don't know if you've ever heard of that before.
People put egg whites too.
Yeah.
Is it the egg white?
My nephew, we're the same age. It's weird. He was running around. My sister dropped boiling soup on his private area. He was like 7 or 8. I still remember it. He's screaming. My sister got him naked, broke the egg, and put the egg whites
The
on
egg
there,
whites.
and it didn't bubble or anything.
I've never heard that. I need to look, because what else have y'all heard? I'll tell you don't work.
Oh.
Mustard, butter. What you trying to cook up? They already burnt. Lard, mayonnaise. Huh?
The mustard always helps me.
Or is it a
It draws like the heat out of it. I don't know how it works, but it works. Yeah.
I'd have to look into the mustard. Now, vinegar does seem to work a little bit. Trying to think if there's anything else I've heard of. Honey.
I heard.
Now, maybe not during the burning process. Does anybody know what properties honey has?
Antibacterial.
It does. There was a time that they put honey into, does anybody know what? Specifically what? Burn and bed sores. They would pack it into bed sores. It's great cough medicine when your children, as long as they're older than what? 1 year. Don't give it to your baby. This is NCLEX material. What is definitive characteristics of a second degree burn? Partial thickness, what?
Blisters.
Blisters have to be present. Now, does it have to be intact? Y'all don't pop the blisters. I know you don't want to. Ooh! No, don't do it. It has to have blisters, period. If it's just red, and what does blanches mean? If I push it, what happens? It turns white again. Does this blanch? Yes, it does. But it has to have blisters. If it blanches and it doesn't have blisters, what kind? First degree. Superficial thickness. Partial thickness. What layers of the skin? Epidermis and dermis. Fluid-filled vesicles. This is key. Red, moist, shiny. Blisters. For some reason, NCLEX loves burn questions. There are several on there.
Do you think it's because of the general prevalence that, like, what is it, how many burns in general?
Guys, what population have accidental burns? Children. Why? Because one, they put everything in their mouth, they bite on electrical wires, stick pennies in there. What other kind of burns do kids get? From hot water, they want to pull something down. What else? They touch your stuff, but what else? Non-accidental trauma. Yes, ma'am. Electrical too. They'll put anything in the electrical outlets. And then after the kids, where do we go then? What about our teenagers? Hey, y'all watch this. They're invincible. Guys, I don't know why my brother thought to do this. You know, if you take a spray, y'all ready? Aqua rain or white rain. There you go. Girl, that'll hold your hair up in a hurricane. And a match, he caught the stuffed animal on fire. My mama came home, she's like, didn't nobody say nothing. Teenagers, you know, accidents, setting stuff on fire, trying to light gasoline. This did not fare well. I don't know what the gentleman was trying to do. He was pouring gasoline into his boat. It was out here. This was public knowledge, so I'm not breaking HIPAA. The propane tank exploded, caught the whole boat on fire, and it threw him out into the water. He was in cardiac arrest when he hit the water. They did bring him to Nova. He did not make it. He had second and third degree burns. I say over 80% of his body. Farming accidents period, and then the elderly. Why do you think the elderly get burned? They have lost sensation. What else? They can't see as well. My grandmother had lost her sight. You know how she figured out about cooking? She would feel down in the liquid. How dangerous is that? I found out she's losing her independence. She had macular degeneration. She was legally blind by the time she died. You know, and she's a very proud woman. She didn't want to admit that, and I found out she's doing that, so I started going up there and cooking for her every day. And I'd let her come over there and stand by me and talk to me while I was cooking. Guys, burns affect people on so many different levels, but you're right, you know, across the entire spectrum of the population. Third degree burns, these are bad. How many levels? All of them. Not to the muscles. Not to the muscles, tendons, and bones. Key characteristics of this burn are what? White, dry, waxy skin. Blanchable, non-blanchable. Non-blanchable. What is this? How do you pronounce that? Escar. That is Escar. That is Escar. That. And you may hear people say that this is not painful. That area is not painful. That's a second degree burn. That is the most painful burn. So no, this area don't hurt. This is the 20%. The 80%, that second degree, hurts like hell. I know that don't hurt. That does. Excruciating pain. Waxy, white, dry. Why does it not hurt? You burn through all the nerves. What is a fourth degree burn? It is considered a full thickness. It is a deep full thickness. Bone, muscle, tendon. A lot of times this is diagnosed when? In the morgue. I don't know if y'all can see that, but that's a second degree burn. A lot of times what causes this? Electricity. Now, thermal burns can do it if the person is in the house long enough. That's bone. I don't know if you can see it, but his hand is gone. All skin layers, tendons, bones, ligaments, and muscle. Remember I told you electrical current, if it's high enough, when it goes through the body, it is so violent it will break bones. I can't say for sure, but that might be why he's missing a hand. If it broke it and then burned it off. The only time I've seen a 4th degree burn, this gentleman was a alcoholic and he had got very, very drunk, and well, that's what we think happened. His family hadn't heard from him all morning, and then the house caught on fire. They didn't know if he was in there, and it was fully engulfed when the fire department got there. They couldn't get an interior attack until they had burned, and then they found him. It was a 4th degree, but he was in there the entire time, and it was a wood house, so it burned hot. You know what the paramedics, this is not funny, but you know what the paramedics' job was? To keep the dogs out of the house. That's y'all best friend. I looked at that fire chief, I said, you want me to do what? Okay. Sir, 1st degree, 2nd degree blisters. That's the eschar. Eschar. Now, that is a blister that has what? Popped. I don't know what that yellow stuff is. Might be a chemical. Might be hair. What happens to hair when it gets hot? It singes, it kind of looks like it melts. It smells terrible. This is just a diagram, if you like that kind of stuff. 1st degree epidermis, epidermis and dermis. All I want you guys to remember is 2nd degree, 1st degree superficial, 2nd degree partial thickness, 3rd degree full thickness, 4th degree full thickness teeth. This is talking about total body surface area contributes to severity. Burns greater than 10% will likely cause. Guys, it's not on your test, but you know there's a burn center here. Where's it at? Is it Vandy? Does anybody know like who goes to the burn center? People that burn like a certain percentage, 2nd degree, 3rd degree, anything involving airway, anything involving the hands and feet, and I think the genitalia, they're going to go up there because these are very specialized. So we talked about the home remedies, right? Do you know what happens at Vandy? I had to spend 2 months up there. When you get up there and you have slathered butter all over that patient, we have to scrub it off. And this is kind of morbid because they are, I'm trying to think what they call it, mortician tables. They're the metal tables with the drain. And I had never worked in there, so we walk in there, and I had never given ketamine before either. And so the nurse hands me all this ketamine and a lot of fentanyl. And I said, how much do you want me to give him? She said, until he doesn't remember my name. I said, is he going to stop breathing? She said, he might initially until we start scrubbing his wounds. And he did. Not, guys, I don't want y'all to think he sat there and I was like, wow. Not breathing for 10 seconds. The second they hit that brush on there, he started breathing. Guys, he didn't start screaming, but he started breathing again. Why? Pain. Even though, what type of drug is ketamine? Dissociative amnestic. They don't remember. Now, they might groan and moan a little bit. And it has pain relieving. And we gave him fentanyl. How quickly do they burn through these meds? Extraordinarily fast. Why? What does pain do to your metabolism? Honey, I don't care if you know what the term narcotic naive means. You don't take pain meds ever. If you have somebody that comes in there that takes pain meds all the time, it's going to take twice as much because they're burning through it and they have a tolerance. So, you know what paralytics are if we're going to put you on the ventilator. What about those drugs? They burn through those twice as fast. Why do I need to keep that in the back of my mind? They what? They're going to extubate. You're going to walk in there and they've snatched that tube out and they're waving it around at you and not breathing. You always need to be thinking about safety with these patients. They will burn through these long-term paralytics supposed to last an hour and they've been in there 15 minutes and they are bucking the tube. This is how we think forward. You know their metabolism is amped up because of the pain. How am I going to know it's wearing off? Not the paralytics, pain meds. You're going to see it in their vital signs. Blood pressure will shoot up. What else? Heart rate. Guys, you might even see them start to cry. They are hurting. They need pain meds. They don't need more paralytics. That means they paralyzed and hurting. And they're intubated. And they had a steam injury. So that's hurting. If you paralyze a patient, it doesn't do one damn thing for pain. Neither does propofol. I have had seasons there, oh yeah, that takes care of their pain. I want to thump her in her no-no square. But that's not my place to educate her. I pulled my entire clinical group out. I was like, I want y'all to go get the drug out right now and look up propofol. Does it say anywhere on there narcotic? No, it doesn't. You got a patient in there who is big boy. He's not burned. He's an asthma patient. He is biting the tube. I don't know why he's doing that. His heart rate was 200. Blood pressure is 200 over 105. Let's just up the propofol. Oh, it's not working.
Maybe
Have you given him anything for pain? No. Well, oh yeah. We're giving him 2 milligrams the first at an hour. Honey, I would have given him 5 IV push. He was a big guy. And his metabolism is what at this point? It's amped up. Then she comes in. I was training in the ER. Now, I've been a flight nurse for a while. She comes in and says, the doctor, here's some cardizem for his heart rate. You know what I did? I'm not giving it. Was I ugly when I responded to her? I said, I'm not giving it. His heart rate is not his problem. His heart's not his problem. He's in pain. Girl, she stormed out. Tried to get another nurse to give it. Nurse's like. Then she ordered what? Pain meds. It was miraculous. She didn't order enough for it to come down some. You got to know pharmacology and the medicines for the unit you work on. We did talk about this. No. So specific locations carry their own set of complications. I know we did talk about this a little bit. What do I mean by functionality? Fingers, joints. You can't just not walk on your feet. One of the worst burns I ever saw involving feet, the lady ran back, it was in the middle of the night, she ran back in to get her dog. She didn't have shoes on. She had 3rd-degree burns on the bottom of both of the soles of her feet. She got her dog out. What? You have to walk. Yeah, I know, it was so sad. She was older too. Is it a functional area? here again. So, what are the parts of the airway? Upper, lower. So, if it affects the upper airway, what do I mean there? You got burned where? Mouth, nose. What kind of breath sounds you gonna hear? Stridor. That means this is closing off. Usually, if we heard stridor, what does that mean? Foreign body, obstruction, or even bad asthma, right? Epiglottitis. Something is causing this to narrow. The burn is a direct injury that's causing edema, or actually they've got soot down in there. You'll hear that high pitch. But what if you hear hellacious wheezing? What has happened? They have inhaled high temperature air. They are burned in where? Lower airways. Do you think it's just lower? It can't just bypass the upper to get to lower. You're burned in both places. And they've got all kinds of what down in their lungs? Soot, chemicals. Sometimes this is the worst. What do I mean? Guys, this is not vain. There are some very nice looking ladies in here, some very handsome men. Y'all are just starting out in your life. I'm not saying this wouldn't affect me. I don't want to get burned either. Burns are so disfiguring. And it happens at the drop of a dime. Yes, they can do miraculous things with cosmetic surgery, but they can't fix everything. One of our firefighters we had to respond. They never should have sent him in. His turnout's caught on fire. The roof collapsed on him. It burned off his eyelids. I think they made a documentary about him. I think they were talking about doing a face transplant or something. He was unrecognizable. That's the first time I'd ever seen anybody's turnouts catch on fire. What do you think happened to him in his life after that? He started what?
Occupational therapy, hopefully, but also probably self-medicating.
Huh?
Self-medicating?
With what?
Probably booze or pills or.
What do you think happened in his family? He turned into not a very nice person. Can't blame him. His wife divorced him. The psychological effect burn has on not only the patient. Think his kids were scared of him? They were little. Head and neck. I told y'all, hair trigger. If the person has on a nasal cannula and puts it right up here to smoke their cigarette, not going to turn out well. That's the worst airway injury I have ever seen, and you can see it go right up. Head and neck, you want to think what immediately? Airway. You're gonna have, and are you doing the intubation? No. But you're gonna think, I need to get the airway box out, and I need to be yelling down the hallway, I need to doc in the room right now, if you're the first one in there. Head, neck, face, airway. Well, what if you jump the gun and it's not head, neck, face, and what if it doesn't involve the airway? Okay. And if somebody yells at you, you tell them, I'm sorry, I'm the biggest patient advocate, and I'm sorry you're not. Have a great day. If I have to. Y'all ever seen Wicked, the T-Pack? Toss. Hands, location, and that's the functional part. Why perineal? Besides the psychological and all that functional. infection. Because now you've got burned skin and you've got urine and feces running all over it. What do you think the number one thing that kills bad burns? Infection. Like you'll get them all the way through this and y'all are high-fiving each other and 6 months down the road they die from an infection. And now you're sad. What is circumferential? All the way around what? Limbs? So arms, legs, what else? Chest. So, what did we say a 3rd-degree burn is? White, waxy burn. Guys, this is the only thing. This sounds terrible. Y'all ever burn steak? How hard is it? Right? Okay. All this is that burnt steak. How good can I breathe? You can't. This is a tourniquet around your lungs. It will not give. What have I got to do? You've got to cut it. You have to cut all the way through. I know, and it is gross. But they can't breathe, and this is a very quick thing. If you don't cut this, they're going to die. So you basically, and it ain't even a, why are you going to disinfect it? It's a, you cut, and you cut, and cut. And you basically cut down through the eschar until you see sub-Q fat, or muscle tissue, and when you cut down, it will pop open, and the chest will expand. That has to happen if this is circumferential. Why does it matter if it's circumferential here? It's going to cut off your blood supply. Sooner or later, it's going to start compartment syndrome. It is like a tourniquet there as well. So, the only one we were allowed to do on Life Flight was this one. I never did it. I was there when one of my partners did it. We never did these. They did these at the, I think we could if we talked to the attending. I saw these done. I don't know how they determined exactly where to do it, or if it was just over the burned skin. I saw them here, I saw them on the finger. I mean, anything. You could have circumferential burns here. Anything that it can burn around. The thermal injury is what makes the edema. The chemical injury causes inflammation, and what is that first word? Bronchoconstriction. This might be the sign. Now, this can be anything that's in your garage that catches on fire. Soot and particles, bronchospasm, and obstruction. If you breathe in all that soot and it goes down in your lungs, can you breathe through soot? No, you have created an obstruction. This is what they will look like, maybe. What's another good sign that they have an airway injury? Even without singed airway. What kind? Not even their breathing. How are they talking? Hoarse voice. You might not see the soot. You might not see the singed nasal hair. Their voice might be hoarse. Guys, you have to have a high index of suspicion with this. This is actually down in somebody's, I think it said it was trachea bronchi, right? Main stem. You see that? Now we can't see this. That's soot. If you tell them, hey, run your tongue out, you see that, that's bad. And you can see his mustache is what? Burned. Hoarse voice. This is bad. This is worser. What's nasal flaring mean? What's it called? What muscles are they using? Accessory muscles. Along with that, what other kind of accessory muscles? Intercostal, subclavicular. What's this one? Did my clinical group see that this time? It was called tracheal what? Mm-mm. Tugging. Tracheal tugging. Was that kid struggling? Guys, you will see it. They are trying everything, and this part will actually draw in. They are trying everything they can to breathe. You will see it with this because their lungs are filled with crap. eschar is not flexible. And there it is. Basically, they have cut down until you see pink, and you see that it opened up, and now that person can breathe. There is an incision there, and I don't know if you can see it, but that's subcu fat. They know that they have expanded it now, and circulation can go down through there. I imagine if we could see that, well, I don't know if it's circumferential. It's up into, can this get yep, anything that's round. So I had never noticed that. He's got a aspiratomy right up through there. I bet that did not bode well for him. Now, eschar is not flexible. What is your muscle sheath? I know I keep going back. I must need a steak. Have y'all ever cut the white shiny stuff off? That's the muscle sheath. It's what holds your muscles together, right? Now, you got a whole bunch of muscles in this muscle sheath. It doesn't expand. Well, what happens when it gets injured? It's what? It can't expand. It's like when you have a TBI. Can your skull expand? Nope. And so then you start posturing and it starts forcing your brainstem out. What's going to happen? It's going to have compartment syndrome. So it's not an eschorotomy. Fasciotomy. How deep do I have to go? To the what? The muscle. This is a lot deeper. Yes, ma'am.
So for that, eschar,
Is-
what do they do to like the spaces like that they cut open?
They have to heal. Have you ever heard about secondary intention? They just heal from the inside out. And it takes a while. Those are the patients. We haven't talked about it. I don't think it's on here. And guys, this is the coolest thing I think I saw on the It Blew Me Away. What kind of treatment do they do for these bad burns? It was amazing to me. What'd you say? Somebody said it. Skin grafts. Guys, this was amazing. And on bad burns like that, it would have to grow in a little bit. A lot of times they would take skin, if it was not burned, from the patient. That was best option. I've seen them use pig skin, I've seen them use cadaver skin, and they would run it through this machine, and like this much would come out this much, and it would have holes in it, and they would just take it and put it over that area, and I guess the holes would allow oxygen to come through, and you'd come back a week later, and if it worked, it would be adhering to that area, and it worked miracles on that area, and it would look like. Now, would it grow hair? No, that's done. What was the main reason we would do that? What is the main function of your skin? Protection from infection. We made it right. It puts that barrier back. You can't just walk around with no skin.
Something else I saw was like for some birds, I saw something about using lobbyists.
Yeah. I saw that on one of the vet shows. I don't know that right now in humans?
I want to say it's outside the United States.
That wasn't Alaska. Yeah. I know I've seen pig, cadaver. I wonder why they don't use other. Well, I guess pig skin because it's a lot like our skin. Do you think sometimes it doesn't work? Yeah. Now, do you see that shiny part? That's the muscle sheath. Now look how deep they had to cut. I know that looks deep, but it's not really. That's sub-Q. Guys, that's deep into the muscles. For any burn, what interventions are we going to do? First thing is always your ABC. I want to look at that airway. I want to listen to how they're breathing. I want to check breath sounds. I want to listen for what? Any stridor, any wheezing. I want to get the first thing I'm going to do is get low, open your mouth. Looking for what? I want to see if there's any soot. I want to look at his face and see if there's anything. On the guys, it's a lot easier for an airway if he's got, I mean, I can look at him and see, is there anything on his mustache? I mean, I guess there's some women that do. What does this mean? Now guys, are y'all going to have this down pat? This is 30% second. No, not the 30%, but you need to know without a shadow of a doubt whether it's a what, or what. First, guys, y'all need to walk out of this classroom knowing that. That is set in stone. If it's got blisters and it's wet, it's what? Second degree. If it's black, white, waxy, you can't blanch it, third degree. If you see bone, tendon, or everything else, fourth degree. I need to know if it's affected their airway. You're always, bad burns, are they stable, not stable? Guys, they are so unstable, you ain't gonna get out of the room. How good do you think their blood pressure is? It's awful. They're so hypovolemic. Where are you gonna put an IV? Wherever you can. You might do an IO if it's not a fourth degree, or you might have a surgeon come in and do a cut down where they try to cut down to find the vein. Central line. From the second they get there, you are monitoring for signs of what? Infection. Guys, this is what kills, and you have given everything. Your full court press. You so tired, and you come back a week later and you find out what? Your patient died. What killed him? Infection. What diagnostics? What's that first one about? Why? I want to know, especially if I suspect that it's a little bit airway, but I'm like, ah. And so I'm ready to pull that trigger for the airway, the ventilation, the intubation, but they're like, I don't know. And then you pull that back and you're like, oh, the numbers are awful. Draw those ABGs. Why CMP? Which one am I looking at? I want to see that potassium. Guys, this is not, I tell you things just to get you thinking. So the potassium, a lot of times, if it's a bad burn, it is a massive flood. So your potassium, let's say it's 6. Can I stand my potassium to go any higher? Nope. Does anybody know what succinylcholine is? It's a paralytic. So, have y'all ever seen it given? So what does it do to the muscles? It causes hellacious muscle fasciculations. Do you know what else it causes? A massive influx of muscle fasciculation and a release of what? it'll throw their potassium up if it's 6 to 9. And your patient will go into cardiac arrest. Never, ever, ever give. Let them take, hey, go draw oxygen and suck. No, no. Huh. Good luck with that. They will kill that patient. 48 hours after the burn, that's fine. 24 hours after, no. No. Now guys, it only lasts about 10 minutes. You ain't got 10 minutes if it's 6. They're going to immediately go into VFib, and it's real hard because is your electricity going to work? That's not the problem. You're the problem. You killed them. Chest x-ray, it's going to take a lot of fluids. They should be very generous with pain meds. What kind of pain meds do you think? Opioids, morphine, what else? Ketamine. Guys, do we give morphine a lot nowadays? We shouldn't. What else do we give? That's better. Dilaudid, what's better? Fentanyl. Guys, I know fentanyl gets a bad rap because of all the street drugs. Fentanyl is a great drug. Morphine is not as good. We took it off the airplane 10 years ago. Because, especially for cardiac issues, because they have all but almost proven that it has an interaction with some of the TPA drugs. I don't want that to happen if you got a clot, right? But there's still doctors that give it. If that's all you can give, I'm going to give it. We ain't dealing with cardiac. Morphine, Dilaudid, fentanyl. Ketamine is a good drug. Now, narcotics are for what? Pain. What else do we need? Pain and sedation. Anxiety. If they awake, are they anxious? Yes. What drugs now? Versed? Ativan. If they're going to be put on the vent, they're going to give them propofol. But even with propofol on the vent, guys, I don't expect you to know this. What am I doing? I'm trying to get you to think. Give you propofol. Propofol is a sedative amnestic, more amnestic than sedative. If I had a patient on the vent flying a life flight, what other 2 drugs would I give them IV push periodically? Fentanyl and Versed. The propofol keeps them down. I don't need a long-term paralytic. Either it's a long-term paralytic or propofol. Now, propofol wears off like that. So you got to be on your toes or they'll snatch that tube right out. You've got to give them pain meds and you've got to keep them sedated, especially if they wake up and see themselves. You will be giving them antibiotics, and after they get to the burn unit, and only after they get to the burn unit, will they start putting things on these burns. Has anybody ever seen the white stuff they put on there? Silvanine. Why does it have silver in it? Do you? That's not on the test. Have y'all ever seen wound vacs? What color is a sponge? Black. The little sheets of stuff that folks that got big folds. Y'all ever seen what color it is?
Gray.
Gray, black. Guess what it's impregnated with? Silver. You could impregnate it with gold. Guess why we don't? Way too expensive. They have heavy antibacterial properties. We don't use gold because it's too expensive. Put the patient out. No ice. Room temperature water. Why not cold water? I said no ice, but why not cold water? Make them feel better, right? Now, I'm not even talking about the constriction. What happens when you get cold? Why do we shiver? You're already hot, right? Now you're producing heat and you're hot. This is going to be the C's we're going to cut off. Why am I cutting off restrictive clothing? If I got my pretty tight top on and it starts to swell, what's that going to turn into? A tourniquet. What about rings? Guys, try your best. Now, you need to be quick. Take them off and give them to the whoever is there. Because if you don't take them off initially, what's going to happen? You got to cut them off. And that is not the easiest thing to do. Now, I ain't never seen none of y'all wear them. Y'all scrubs actually used to look like the 1970s tracksuits. Nylon, what happens when it catches on fire? It melts into the skin. Do not try to remove that. You will tear their skin off. Now, cool it off. If they're on fire, put them out. We don't usually get them in the emergency room on fire. Usually. Now, if they come in and the fire department just put them out, you can cut around it. Don't pull it off. That's not your job. They've got to go to the operating room and get that cut out. If it is melted into their skin, just cool it off and leave that to the other people with the sharp objects. Cover the wound with, if you don't, they make something that's called a burn sheet. And it is, y'all ever seen a Telfa pad? You use it, it's shiny, and it is, you put it over wounds that it won't stick. Because y'all ever put a gauze pad on something that's bleeding a little bit, and then you try to take it off, and you're gonna be crying, and you gotta get in the shower and wet it and gradually pull it off. This burn sheet is like a big Telfa pad. It's shiny because burns do what? Don't y'all say they stay moist? I want y'all to know that Dr. Butler saw my shirt. She said, "What's that moist about? I just don't understand the moist." I was like, "I'm gonna hit you." See what y'all did? They weep. Even if it's around if it's an intact blister, they'll burst and it leaks out fluid. If you put something against it, it's gonna stick. These don't. What if you don't have one? Just put a sheet over them. Guys, you have got to keep them warm. And that's hard. They will drop their body temperature so quick and go into cardiac arrest because their electrolytes are off as well. Never ice. Never any salves or home remedies. We have to scrub off what you slather on. Interventions, here again, airway, breathing, fluid resuscitation. A lot of times here, are we going to be giving blood? Only if there's a lot of trauma associated. What are we going to be giving? Crystalloids, maybe albumin. Normal saline or lactated ringers. Lactated ringers. Especially in this population. Every now and then you may give sodium chloride, but a lot of times it's lactated ringers. Guys, you have got to keep them warm. The rooms up in the burn ICU, if you are not uncomfortable, then you need to go check in somewhere and get your temperature gauge monitored. Like you sweat so bad, it ain't even funny. Electrolyte monitoring, and they will be doing these serially through the day. Pain management, wound care, monitoring for signs and symptoms of infection. I'm not going over the Parkland formula, you're not going to have questions about it. Don't make this harder than it is. The emergency phase, what are we focused on? Airway, breathing, circulation. Now, I can't get away with not telling you guys the numbers. 0 to 72 hours. But I'm not gonna focus on the hours. What do you think I'm gonna focus on? Prioritization. If a patient comes in and this is the acute phase, what are you going to focus on? Airway, breathing, circulation, giving IV fluids, keeping the patient warm, maybe even intubating and putting them on the ventilator. Airway management, fluid resuscitation, prevent what? Shock. Guys, they were going to shock so fast. And it's distributive, yes, and all their fluids leaking out. They're thirst spacing and their fluids leaking out. Is hypovolemia on top of hypovolemia. Then they have no cardiac output. Then their heart starts to die. Now what kind of shock? Good God. Listen, can we add anything else? We can't get anaphylactic, I don't guess. I don't know. I'm sure y'all can tell whose website that's from. What is this? Simple Nursing. He's the one that always puts the NCLEX tips. We've talked about this before. How do we know they're adequately resuscitated? Best assessment. Urine output. If it's 10, we got a ways to go, right? If it's 30, we're right on track. So it's either the urine output, our blood pressure is right on where we want it to be. Our heart rate less than what? Ooh, you might see all three. Number one intervention for major burns. This is an NCLEX thing. IV lactated ringers. Does this trump airway? Absolutely not. Wait, that's it. Did anywhere up here say they are adequately resuscitated if their potassium is fine? No. So we said the emergent phase, 0 to 72 hours. 72 hours to wound closure is the acute phase, right? Now, you always worry about ABCs, but it's a different ABCs now. You might as well throw that one at the top. This would be your top priority, right? Infection control, wound healing. How much nutrition do you think they get? Oh my Lord. Like guys, I'll be honest, I never understood the language the nutritionist was speaking when we walked around, because they started throwing around all these kcal numbers. All I know is that the numbers that they was giving these patients and the numbers they was giving the MI patients, these were like triple. And they would give them, look, they said, whatever the patient wants to eat. I was like, he wants to eat the whole cake. Give him the whole cake. The whole cake? The whole cake. He's a diabetic. I don't care. The whole cake. Now, what did they want him to eat? Proteins. If we couldn't get proteins in him, they would give him whatever we could get in him. But a lot of times, what did they have in? G-tube, Dopolf, whatever. Nutrition, still pain management. Do you think these wounds hurt when they're healing? Yes. Acute phase is all about wound healing and preventing infection and supporting nutrition. Did I say anything about rehab? That's not that. Is the rehab phase. What kind of rehab are we going to do? Physical therapy and occupational therapy. What if I burn my hands and I'm a nurse? I mean, there might be a possibility. What if I only burn my left hand? Can I figure that out?
Yeah.
I mean, damn it, the Def Leppard drummer, he figured that out, didn't he? This is a focus on restoring function if you can. This is post-wound closure, probably what, forever? Maybe not. I wanna prevent complications. What did we say about the joints? You might have contractures. If you do the physical therapy and occupational therapy, maybe not. Scar management. A big thing here is they will teach them to wrap what? Say it louder, Jennifer.
Themselves.
They'll wrap them with ACE wraps to put pressure, and it helps with scarring and wound healing and edema. And it's pretty tight. Like the first one I wrapped, that nurse is like, I was like, I'm gonna cut off. They're like, Shayla, there's a fine line. It took me like 2 or 3 times to wrap this, and I'm like, I'm gonna cut off her circulation. And they're like, no, it's a kind of a learning curve, but we had to do this every day. You didn't leave them on all the time, but when they were up, you had to wrap them, and then you would take them down. And they teach them what? It ain't just while they're in the hospital. They go home and they teach them how to do this, and it really helps with scarring. What do they teach them to put on their skin? What do we put on our skin during the winter? Lotion. Guys, those scars are there. They might tell them to put vitamin E. What does it help with? Scarring. They might not feel like this. And you might have to do some workarounds. Do they need to exercise? What kind of exercise might we do? If all the wounds are closed and we're not worried about that anymore, swimming. Why? It is the lowest impact and it takes away gravity, right? And look, let me tell you what, them little old ladies in the pool, I can't give up. I'm telling you, right now. I love breathing hard. We need to teach them what? Signs and symptoms of infection. What else do we need to give them information on? Social support. What would be a good group for them to go to? If you've got an addict, who do they need to talk to? Another addict. Huh? A burn survivor. If you've got a breast cancer survivor, who do they need to talk to? Somebody who has walked in their shoes. I'm not saying that somebody that is an addict, because I've seen counselors out at Cumberland Hall that have never been an addict that were awesome, but there was just a little bit of something that was missing. And they didn't garner the respect for that little lady. I don't know how tall she was, like 5'2", and lived, honey. And she'd throw it out on Front Street. She said, every day I battle with it. And immediately, everybody in that room was like, yep. They need to know the resources in the community. Here we go. Water-based, not petroleum. Don't slather on the Vaseline, the Eucerin, what else? Wear your pressure garments. Nowadays they probably make things that you don't even have to wrap anymore. Exercise daily. Why this? To help you what? Not get those contractures. Has anybody ever worked in a nursing home? If you had a patient that was bedbound, do you know what you would do every day? Patient can't move. You move for them. Because if you don't, they're still going to get contractures. Questions? Wednesday's lecture is not very long. And I have gone back and forth because last semester I've never taught transplant. And they put a lot in there about every different kind of transplant. But that is a very specialized, it's like oncology nursing. I think he would be better served if we talk about complications, the meds, and the precautions. What is the biggest precaution? Infection. These patients are always on neutropenic, yep, that's it. That's right along with that EKGs that y'all need to do. So y'all will have to know what neutropenic precautions are. I'm telling you right now, that's testable. I probably will be putting that PowerPoint on today. I think it's less than 15 slides. Any questions about this? All right.
Are you